Welcome back, everyone. It's 6:12. This morning, some hospitals across the state of Texas are once again being pushed to their limits as COVID cases surge. But in El Paso, we have yet to see our ICUs fill up with coronavirus patients. Joining us now to discuss the situation is one of the top infectious disease specialists in our region, Dr. Ogachika Lozzi. Doctor, thanks so much for being here with us this morning.
Thank you.
Doctor, I want to start with this. What are you hearing from your colleagues in other cities, and what can you say, and what are they telling you specifically about what they're seeing in hospitals?
Yeah, I think it's important to understand that in Austin, Houston, and Dallas, they're concerned. Their hospitals are at capacity or above capacity in many cases. They've actually sent patients not only to our city, but other cities across the state. And not just for COVID, but for what we call the sort of run-of-the-mill, what comes into the hospital. So I think we don't want to get there. I personally don't believe we will get there. We're in a good position. We're only at 4% of our capacity if you look at the EP Strong website. And so we're not Austin, we're not Houston.
Yeah, I want to discuss the level of protection that we're seeing in El Paso. Of course, we have one of the highest vaccination rates in the state, plus the natural immunity because we had such a high increase of cases last fall. So you kind of answer that question there, but you think that we won't see what other cities have?
Yeah, again, I think you never want to be too overconfident, right? And I think it's important to continue to focus on that 20% of our population that doesn't have vaccines. But I think you hit the nail right on the head, and I'm really glad you talked about that natural immunity. We probably had 20 to 30% of our community that already had COVID. And then on top of that, the 60 to 80% that's been vaccinated, we're in a good space. That's why we haven't seen our numbers go up dramatically. Now, kids are a different breed, right? Under 12s, and I know we'll talk about that in a minute.
Yeah, that's one of the things I wanted to talk about. So the Delta variant, we've seen it in other cities with particular children's hospitals seeing more and more COVID patients. So is there any evidence to suggest at this point that the Delta variant has a stronger impact on children?
Yeah, so great point. I think that it's important to really look at the data here. And the data doesn't show that this variant is necessarily more virulent or makes people sicker. What we do know is it's more transmissible. And remember one thing, like you said before, we didn't have kids in school the same way we have now. When you and I talked a few weeks ago, I said this is going to be a stress test to our schools and our public health system. Now that we have more kids in school with a virus that's more contagious, you expect to have more cases. We don't expect to have sicker kids, but there's going to be a lot more kids that are infected.
And lastly, your reaction to El Paso's newest mask mandate.
Yeah, well, I think Dr. Michelson of UMC and Texas Tech hit it right on the head. This is a political decision, right? The data and the science, and I think this is really where the ISDs and the public health department need to push. It's time to have an ISD vaccine mandate, right? If we really want to protect my children, your children, other people's children, the best way to do it, the most data-driven way to do it is get them vaccinated. The masks are important, but again, remember, a mask is not a mask. It's a KN95 or an N95, at the worst, a surgical. All the other masks are performative, and that's not the solution.
Dr. Lozzi, thank you so much for your time and your insight. We always do appreciate it.